This week, we're going to be talking about psychological disorders. We have 3 videos. The first deals with the nature of disorders. The second deals with depression and mood disorders. And the third deals with that serious, debilitating problem of schizophrenia. Now, next week, we'll finish up the course talking about treatment, what we can do to help resolve some of the psychological disorders. Now, what causes psychological disorders? Well, there are 3 factors. First, there are psychological factors like stress, mood-related problems, and learned helplessness, and I'll talk about that in a minute. But there are also biological influences. Evolution itself has made us adaptive, and that affects certain behaviors. Individual genes have been identified that are important for psychological disorders, and then brain structure and brain chemistry itself will be important to look at. And then there are social cultural influences. We play different roles. We have different expectations, and there are cultural norms that control what abnormal behavior is. Abnormal means different from the norm, and we have to understand the cultural norms to understand the abnormal behavior or psychological disorders. Now let me just mention something about learned helplessness. Martin Seligman is the person who developed this, and it really is an important concept in understanding a psychological process that controls disorders. Sometimes we just can't control bad events. They happen, and we don't have control over those. There's nothing you do to control it. And that leads to learned helplessness. We just feel like we are helpless in resolving our own problems. Let me tell you what Seligman did. He actually developed a box like this, and he put the animal in the right side of this box, and then he administered small shocks. Not shocks that would hurt the animal, but shocks that they certainly didn't want. And there was nothing the animals could do to reduce the shocks. They just had to deal with it. And then he put them into this box, which is a jumping box, where if they simply jumped over the divider in the box, they could get to a point where they would avoid the shocks. The left side of the box, there were no shocks. The right side, there were shocks. So we had 2 groups. A group that had experienced the uncontrollable shocks for a period of time, and then a group that's just controlled, first time in the box. The interesting thing is that the animals that experienced the shock that they could not control did not learn to avoid the shocks by jumping over the partition. The control group that hadn't experienced the uncontrollable shocks learned quickly to simply avoid the shocks by jumping over the partition into the left side. In other words, the animals that had experienced the uncontrollable shock had learned to be helpless, while the animals that hadn't had that experience were able to jump over the partition and escape and avoid the shocks. Learned helplessness. And Seligman believed, and it's become an important construct in psychology, that learned helplessness is one of the things that sort of controls psychological disorders in so many people. So we have bad events that we can't control, nothing we can do to control them, and so we learn to be helpless in situations that maybe we could control. The opposite of this is also important, and that is that perceived control, if we feel like we can control things, really is important in determining happiness. So control of the situation is an important construct in happiness, in self-fulfillment, and in helplessness if we feel like we can't control it. Martin Seligman, learned helplessness. Now I want to talk about the Diagnostic and Statistical Manual. In 1994, the American Psychiatric Association issued this manual, which tells you all of the different categories of psychological disorders. And so it's really a diagnostic sort of manual, is what it says. And the one was issued in 1994, almost 20 years ago. It is developed by the American Psychiatric Association, not the American Psychological Association. And the interesting thing is that this year, on May the 18th, the DSM-5 was released, the first new diagnostic manual in 20 years. And we'll talk about some of the categories that are listed in that manual. There are over 400 different disorders that are defined by the DSM-5, and so it's become sort of the way in which we can categorize diagnoses of psychological disorders. And here's a picture of DSM-5, which just released a few weeks ago. Now, when you looked at OLI and talking about psychological disorders and talking about DSM and DSM-4, there were these 4 axes that were listed, and you can categorize every disorder on the 5 axes. Why do I say 4 when they're 5? Well, they're 5. And dealing with the clinical syndrome, personality disorders, are the physical comorbidities, the social environment problems that a person might have, and the ability to function in everyday life. The interesting thing is that in DSM-5, they go away. So I will not be testing you on the 5 axes of clinical disorders because they're no longer present in the DSM with the one that was just issued a few weeks ago. Now, what are the changes between DSM-4 and DSM-5? Well, there are always changes in the categories of disorders that are listed in the DSM. For example, the autistic disorders were renamed and reshuffled in childhood disorders in DSM-5. We'll talk about that today. They added some new disorders. There's now a binge eating disorder, a binge drinking disorder, excoriation, which is sort of skin picking disorder, and hoarding disorder. There's actually a television show on just people that hoard, people that collect things and won't throw anything away. And there are now specific learning disorders. Rather than just saying learning disability, we have specific ones for oral language, for reading, for written language, and for math. So they're a category now of learning disorders. So they're the big changes in DSM-5. So what are we going to be talking about this week? We're going to be talking about anxiety disorders, mood disorders, schizophrenia, personality disorders, and childhood disorders, all categories of psychological disorders in DSM-5. Today we're going to talk about anxiety disorders, personality disorders, and childhood disorders. The next video we'll talk about mood, and the final video we'll talk about schizophrenia. So let's talk about anxiety disorders. There's several different types that we're going to discuss. The first is sort of a generalized anxiety disorder. It's sort of free-floating anxiety, sort of always being worried and not really knowing what it is that you're worried about. That's the most common of the anxiety disorders by far. There are also panic disorders where for about 20 minutes the person is in an absolute stage of panic. The heart is racing, their breathing is troubled, and it lasts for about 20 minutes. Sometimes you have to actually, if you're driving a car, you have to actually stop until this panic disorder goes away. Fortunately, it does go away. Usually they last from 10 to 20 minutes. The third is obsessive compulsive anxiety disorder, and this is where the person has obsessions, constant thoughts about something that's disturbing, and then also has compulsions, sort of repetitive behaviors to do something. The person has obsessions about germs. They might have a compulsion of always washing their hands. Now, washing your hands is good. We should do it. But doing it 50 times a day probably is a compulsion. So obsessive compulsive disorder, obsessions, constant thoughts about things that are unpleasant, and then compulsions, those thoughts lead to repetitive behaviors. Then there's also post-traumatic stress disorder. This is very common now with people returning back from Afghanistan and Iraq. This is a constant stress produced by a trauma, like fighting in battles, or it could be being in a natural disaster, like a hurricane. And these disorders, these stress disorders, can occur months or even years after the trauma had occurred. Post-traumatic stress disorder. Then there's dissociative disorder. This is actually the multiple personalities that were made popular by the movie Sybil with Sally Field, and the movie The Three Faces of Eve with Joanne Woodward. The people that have different personalities that are very different from each other, and one personality will be in control while the others will be repressed, and they will vary, go back and forth. Now, this is a controversial disorder because there's some controversy about whether it actually exists or not. It ends up that these disorders occur are observed only during therapy, where somebody, for example, could be hypnotized and then they develop this other personality that comes forward. So there's some controversy about whether this really exists. Somebody found out that in a country in Europe that most dissociative disorders were diagnosed by 1 or 2 or 3 therapists, while most therapists never experience a dissociative disorder. But it's really the split personality, dissociative disorder. Then we have phobias. Phobias are a rational fear of something. We all have fears, but if it becomes irrational, then it's called a phobia. I happened to watch a couple of series of the Monk television program, and of course, Adrian Monk is absolutely covered with every phobia known. I put a phobia on here that I probably can't even pronounce, paracavicidecatria, which is actually the fear of Friday the 13th. Yep, there's a phobia for Friday the 13th. If you want to look at phobias, there are hundreds of them listed on phobialist.com, where you can see, you can look up your favorite phobia, or the one that you're most bothered about. There's fear of flying, there's fear of being in tight spaces, claustrophobia. There's fear of being in open spaces, there's fear of being around people, there's fear of bugs, there's fear of snakes, there's fear of... But if it bothers your everyday functioning and becomes irrational, then it's an anxiety disorder. By the way, anxiety disorders used to be called neuroses, which were disorders that didn't raise themselves to the level of psychotic disorders, but now they're anxiety disorders. Okay, now let's talk about personality disorders. Remember, they used to be one of those axes that the DSM worried about. Now that's a separate category. But the reason they were different axes was often you could have a personality disorder in the same way that you had a psychiatric disorder. But now we know that, now that belief is that they really are separate category. There really are just extremes of normal traits. So if you're an introvert, you can have a personality disorder if that introversion really takes over you. It becomes really exaggerated in controlling your behavior. There are inflexible patterns of behavior. That's what personality disorders are. They impair the person's functioning just like a phobia might. They're not serious psychological disorders. You're able to function, but they are something that can be diagnosed. And they're difficult to diagnose because it's just, is it an exaggeration or an extreme of a normal trait that we would see? That has to be determined. And like I said, DSM-5 proposes 6 personality disorders, and I'm going to list those. This is the new DSM. I say draft because it was a draft when I made this video, but now it's been released. But the draft is now, this is a draft, but it's finalized. It was finalized last week in my time. DSM-1 had 15 different personality disorders. DSM-2 had 10. DSM-3 had 11. DSM-4 had 10. And then 4 were dropped, so the DSM-5, the new one, only has 6. And those are, first, schizotypal, which basically deals with odd thoughts or odd behaviors. Somebody that has idiosyncratic thoughts or idiosyncratic behaviors doesn't rise anywhere near to schizophrenia, but it is something that you can categorize. The second is borderline, which is a person who has difficulty in interpersonal behavior. There are wide mood swings, not that it comes as a mood disorder, but it does characterize this person. The reason borderline personality disorders are important because it's a predictor sometimes of suicidal thoughts. So it's something that people watch for. Obsessive compulsive, a person is a perfectionist, they follow rigid rules. It doesn't lead to the level of an anxiety disorder, but it does characterize by thought and behavior patterns. And the fourth is avoidant, which is a strong feeling of social inadequacy, so you avoid social situations. The fifth is narcissistic, which is grandiose views of our own importance. They demand attention and are very, very bothered by criticism, narcissistic. And then the last one is antisocial, where behaviors are destructive to the self and to others. And antisocial personality disorders are important because they tend to predict criminal activity. Okay, let's talk a little bit about childhood disorders according to DSM-5. First, there's the attention deficit and hyperactivity disorder. where the child, and this usually occurs before age 7, the child is easily distracted. They're very difficult for them to complete a task. Their attention disorder is they just cannot pay attention for long periods of time. It's inability to concentrate. It's controversial because it's diagnosed in so many children. And many people believe that it's overdiagnosed, that we simply have a child that's very active, sort of hyperactive, and doesn't mean they have a personality disorder. Because one of the treatments for ADHD obviously are drugs, and the feeling by some people is that might be overprescribed. Now, autism spectrum is where a child has problems communicating, they have impaired social interactions, they do these repetitive behaviors, and DSM-5 has eliminated Asperger's syndrome and collapsed it into this one diagnosis of autism spectrum. This is not schizophrenia in children. It's these repetitive behaviors and problems communicating with language called autism spectrum. Thank you.